So thank you very much for the kind introduction from Joe. I'm delighted to be here for a couple of reasons. Number one, being a Brummie, it's great to hear a proper accent for once. I was sent up to Manchester and the accent is not great. I'm going to go wander down Gas Street in a minute after the conference to remind myself of my youth. The second reason, I think more importantly, it's the first time I've gone to a conference and presented something to a group of patients, which I think we need to do more as doctors. We need to speak to patients, particularly in an organization like this. So I'm an interventional radiologist. Now what that is someone who delivers treatment via a minimally invasive method. So you have your traditional methods of treatment with an oncologist who gives you therapy through a vein, and it allows you to have systemic treatment for something, a surgeon who's able to take something away and operate on you. Now the third group is the minimally invasive group. So I use X-rays to go into the area in question and deliver treatment. And that's what liver-directed therapy is. So not only for ocular melanoma, I do liver-directed therapy treatments for numerous other cancers, including primary liver cancer and also cancer which spreads to the liver from another source. And I have to say, with the ocular melanoma group, it seems like everybody knows each other. So I have patients in Manchester who know patients from Birmingham, who know patients from Southampton. And the chap who runs a lot of the treatments in Southampton, we both trained together in Birmingham. So it seems like a very, very small community, and I'm glad to be part of it. What I'm going to be doing is talking a little bit about what chemosaturation is, because as I can imagine, as a patient, it's very straightforward to talk about a systemic treatment or an operation. But actually this is very off-piste. And what I'm going to do is show you a few videos of the actual procedure itself, and explain a little bit about what's going on. And I'm also free for questions afterwards if anybody wants a little bit more explanation. Who is it for specifically? So I'm going to present our referral pathway and what we look for appropriate treatment referrals. Now, Joe's touched on the accessibility to the treatment, and it is going through the appropriate channels through NICE and the NHS. And I am going to present a couple of stories about patients who have crowdfunded the treatment because it's not openly available to the NHS, but the work that Ocular Melanoma UK are doing, and actually yourselves as patients, is driving that significantly. One of my patients who I'm treating in a couple of weeks has been on the BBC, and hopefully we're going to try and push a little bit more media out there to try and drive this and get NHS funding. But again, they're doing a fantastic job, Joe and the team, and also the guys from Delcath, to try and push that and get it reimbursed. And I'm going to talk about two specific cases, and that's where I'm going to put in the videos and show you exactly what a chemosaturation procedure entails. I'm just going to finish off on a card I received a couple of days ago from a patient who I treated, and it's a fantastic story. So chemosaturation, I don't know how much people know in the audience, it's for patients who have got the primary area of disease, but unfortunately it's spread to the liver. And the idea is we need to isolate the liver and just treat the liver itself to avoid giving chemotherapy to the rest of the body. The reason you have systemic effects to chemotherapy is because not only it targets the tumor, it also spreads everywhere else, and that can cause side effects. If we can isolate the chemotherapy to the liver, we can increase the dose. What reduces the ability to give a high enough dose is the systemic effects chemotherapy has. So this is a procedure where we isolate the liver in question and deliver very, very high dose chemotherapy. And I'm going to go through the videos to show you exactly how that works. So this is a schematic, but I'm going to go through videos to show you how it actually works. So what I do is I deliver chemotherapy through the artery into the liver. Anything going into the liver has to come out again. So it goes in through an artery, leaves via a vein. The problem is if we allow it to leave the liver into the vein, it will spread all the way around the body and cause quite significant side effects. So what happens in chemosaturation is through the artery, goes into the liver, leaves the liver, but doesn't go into the systemic circulation. So we've got two balloons here, which isolate all the blood in that area in the main vein inside the abdomen. It's then drawn out through a catheter, which I insert through the groin. It then goes through this bypass machine, and these two cylinders here are two filters, and it filters all of that chemotherapy away. I then return the blood back into the body via the heart through the neck. And the reason we do that is because we can get rid of all of that chemotherapy, which is potentially going to spread around the body, and return it back to the body. It means we can give really, really high dose chemotherapy to the liver in a couple of sittings, which gives the best chance of getting good response. Does that make sense? I'm going to go through the videos as well, which makes even more sense. So this is something I picked off the OcuMel website. It's just to show that actually over the past couple of years, there's been a greater media response to this treatment. You can imagine the public in general don't know anything about this sort of thing. And this is a very positive thing. So it means that we're actually getting more and more media exposure to the procedure itself and actually its benefits. As we've heard in the audience and from the previous speaker, you can feel quite isolated having ocular melanoma because of the numbers involved. But actually, we have a very effective treatment in place. We just need to drive it a little bit more through the media. This is the group in Southampton who are the biggest practice centre for chemosaturation. So Dr. Modi is a friend of mine. So this is the paper they published, which does highlight progression-free survival. So what that means is it's effective in keeping the disease under control and overall survival benefit, which means that actually you have prolonged survival, even if you do have disease to the liver. So there is evidence to show that there is a benefit to this. The one thing this paper highlighted is that we do need more studies to support its use. So in medicine in general, anytime you bring in a new procedure or a procedure of any kind, you need to have supportive evidence. So opening new centres like ours at the Christie, Southampton and in London, we need to collate all of our data and present it again to demonstrate that actually there is significant benefit. And anecdotally in our cohort so far, we've had significant response to this treatment. A little bit about NICE. So NICE is an organisation which recommends a treatment to the NHS. So there's two different stages. So NICE recommend a treatment. They look at all of the data and they say, yes, it is effective. No, it's not effective. NICE recommend this treatment to a certain point. And again, Joe and the team are working with NICE IPAC committee as well as the NHS to try and get that upgraded to the point where actually it should be provided on the NHS. So I'm not going to mention too much about that because of what Joe mentioned earlier. What I'm going to mention are these patients. So these are the patients who are driving chemosaturation for this particular reason. And Mr. Shaw, who I'm treating in a couple of weeks' time, has done a fantastic job in terms of crowdfunding and getting more exposure through the media to try and get this treatment available on the NHS. Unfortunately, not everyone has access to it. But people like this are pioneers in trying getting this treatment pushed forward. So I'm going to talk a little bit about the Christie experience. So this is the referral pathway. This is the pathway the patients all come through before they're considered for chemosaturation treatment. So the patient's referred to our centre for the treatment itself. And the first thing we need to ensure is that the disease is only isolated to the liver and there is no evidence of liver failure. So the liver has to have a relatively good function for us to do this treatment. Without that, we may actually cause more damage than do any good to it. Relative contraindications are things that may turn us away from delivering the treatment, but we look at it in a little bit more detail. So that's something that we do look through before the patient is considered for the treatment. We then have something called an MDT. I'm sure a lot of you are aware of what that is. It's a meeting where we have groups of clinicians who decide what's the most effective treatment for the patient. And that's where it's agreed that, yes, chemosaturation is appropriate. So I had this morning, actually. We then do a few other tests to ensure everything else is absolutely fine for us to then go forward and to deliver the treatment. So at the moment, there are 3 major centres. There's ours, there's a centre in London, and Southampton who provide the treatment. So I'm just going to go through some cases because I think visual aids are far more important than me just blabbering on about studies. So we have a 72-year-old female, and this lady I'm going to talk a little bit about at the end of the talk, who had primary ocular melanoma, was treated at the primary site, but unfortunately presented with multifocal sites of liver disease, no other disease elsewhere in the body. and was referred to us for chemosaturation treatment. Now, she went through the pathway I mentioned earlier and was deemed suitable for the treatment. So this is an MRI. I'm just going to pause at one point. I'll just rewind back. Sorry, I've got don't know if that's projecting very well, but this is an MRI scan. And I don't know if you can see, but there is a small area just here that I've arrowed, and that's the area of disease in question. Now, it seems rather small in comparison to the entire organ in question, but these are the areas that can grow significantly and spread to other parts of the liver. So actually it's important to get in early rather than wait for it to spread significantly, because if it does spread significantly, it can have complications to the actual function of the liver itself. So it's important to get into these cases early. So I'm just going to run through this video, and then I'm going to talk through what we're doing here. Is that projecting well? Right. Now, what I have here, this is the screen we see in our theatre. You can see there's a long tube which is coming down from the top of the screen, bends and goes into here. So this area here is the liver. This little artery is the main artery supplying that part of the liver. And this is the heart, and this is the lung, and this is everything below within the abdomen. Now, what I'm doing here is I've got this little tube directly into the liver artery, and I'm delineating what the main blood supply is to that part of the liver. So this is what we call the check stage of the procedure. So this is right at the beginning. We then move to the second stage of the procedure. So I'm going to let that run. I'm going to talk you through what this is. If you remember back to the first image I put at the beginning of the talk about what the procedure is, I don't know if you remember the two balloons. So what those balloons do is they isolate the vein. So all of the blood is going into the artery, and it wants to leave the liver via the main vein. And these two balloons are stopping it going into the heart. So what this does, all of this dye is then isolated into that small area between the two balloons, and the blood is going to be leaving the body through this tube down here, out to the groin and through the two filters, and then it's returned back to the body itself. And this is me then starting to infuse the chemotherapy through the artery with the balloons in place. So it means that I'm isolating the liver from the rest of the systemic circulation. I can give that really high dose chemotherapy, and everything else is drawn out and filtered. So this lady had disease control for 2 years, which from someone who treats liver-directed therapy for multiple cancers is unheard of in a lot of cases. She has been referred for a second treatment, but she can't afford any further treatment. So at the moment, she's crowdfunding for another treatment. And these are the kind of cases we need to try and put forward to the NHS to try and drive this a little bit more. But for someone who's managed to control a disease for 2 years, it's fantastic for her. So this is a 55-year-old chap, case 2. He presented with relatively small volume disease, so small little ditzels, but all over the liver. So it means we need to really treat him at this point. We can't let it get any worse. His primary site was treated with surgery, so he had his surgery, but then he was referred then for the chemosaturation procedure. So I'm just going to go through his CT, and there. Whoops. Let's go back. So again, this is a CT scan. It's a method we use to try and delineate the areas of disease in the liver. I'm just going to scroll. Now, this is the liver here, and I don't know if you can make out these areas of hyperdensity, and they're the areas of disease. Unfortunately, this patient actually has a few other areas as well, which was picked up on the MRI. So he was referred for chemosaturation. And this is the stage of the procedure where I'm inflating the top of the balloon and just pulling it down from the heart into the main vein in the abdomen and placing it in the correct position. You can see it's starting to form a pear shape, which is what we like to see in the middle of the procedure, because it means we're obstructing the blood flow back up to the heart. The next stage of the procedure, the bottom balloon's then inflated, and the bottom balloon locks those two balloons in place. The treatment's then delivered through that catheter into the artery. Nothing's going into the systemic circulation, and we're filtering out and returning to the heart. So I give a very, very high dose of chemotherapy to this particular chap. And he's done really well. He's had 2 treatments. He's coming back in a couple of weeks for his 3rd treatment. And his disease is completely gone. So he has nothing left. But we're doing a third to ensure that we've given as much chemotherapy as possible before we see how he gets on subsequent scans. So in conclusion, it's been positive for us. We've had fantastic responses. We've got appropriate patient selection. But I think there is a need to try and collate all that data. And we are working on that with the other centres and present that data both to NICE and hopefully support the NHS decision later down the line. I'm just going to end on this. So this is a card that was given to me 3 days ago from one of our patients. She was a fantastic lady. She was a lady who was a bowls champion. So she came in for her procedure, and the first thing she asked is, can I go and play bowls tomorrow? Because I'm up for the championship and I want to win. So that's no problem. So we changed the procedure, where instead of putting the artery access into the groin, I put it through the wrist, meaning that she can actually walk around afterwards and go straight for a bowls match. I did warn her left wrist might be a little bit sore afterwards, but next day she went to a bowls match and she told me that she held the ball just underneath her bicep, went to return to her right hand, and she bowled and she won the championship. The one thing I want to highlight is that bottom area here, to keep up the fight for this treatment to be on the NHS. So that's the idea of these sorts of groups, it's not just a doctor telling you what we think is appropriate, it's actually you giving us more information back to say, actually, it's worked well for us. It could work well for other patients who unfortunately have this disease. Thank you very much.